Hello, and welcome to this episode of Innovation Obsessed. I am so excited today. I've been looking forward to this episode, and it's finally here. So today we have the Robin Goldsmith. He hosts Healthcare on Air, and I'm going to read your title because you have a quite impressive title. He is the global lead for connected health and innovation at Verizon Business, Healthcare, and Life Sciences Practice. We also have from Usto, Patrick Welsh. He is the GM of our Americas division. And Patrick, much like Robin, is on the front lines every day with our healthcare clients. So to get started, Robin, I'd love for you to share some of your background and what got you into this industry, what makes you so passionate about being in this space.
Yeah, I think Patrick will probably agree. Healthcare is tough, but I think people who work with, across the healthcare ecosystem have passion for it to make change. I've been working in the healthcare industry for about 18 years. I think, I'll tell you a story. When I was 18, I was a lacrosse player, and I was at the University of North Carolina at an elite lacrosse camp, and I had an incident where I ended up at the University of North Carolina, Chapel Hill, for about 3 weeks. And I think that impacted me pretty heavily because I was pretty sick. And I just remember, that's why I have a passion for nurses, because they really were my lifeline, being alone in a hospital, away from home. And I think it just kind of set that hook of really respecting healthcare and respecting, like, if you don't have your health, you really have nothing. And, at 18, you're pretty malleable. And I just remember it really made a big impact on me. So when I got the opportunity to join Verizon during the pandemic, where, as we all were, experiencing connectivity and doing things through screens, like Patrick's here today, doing that. And I kind of had that light bulb moment of, Verizon and the telecoms can make a big impact in healthcare, and we really need this kind of technology to have the connectivity, which we're going to talk about, I know. But it's a really fun role, and it's unique. I always say I have the coolest job at Verizon because I get to work with, our healthcare customers across, hospitals and healthcare systems, med device, pharma, life science companies, and really see, what the thought leaders are doing. I get to do the podcast, like you said, and talk to a lot of folks. I'm super privileged. It's a fun space to be in. And I think, I always like to quote Dr. Charles Bruce from Mayo Clinic when he said, we find ourselves at an inflection point in healthcare, unlike anything we've ever seen in our lifetimes. And that door to innovation has been opened, and we must, emphasis on must, continue that momentum. So I think that's what makes me get out of bed in the morning and be excited about this space, because I think a lot of innovation has been accelerated, and I'm just, I feel privileged to be part of that.
I love that. And that's such a great quote, and a really good segue into our conversation with Patrick today.
Yep.
Patrick, I know that in a lot of the healthcare clients we're talking to, they're talking about that tipping point, right? That inflection when it comes to workplace violence. And they know that they need to do more. They know they need to do more to protect staff, to protect patients, and also to protect visitors. They're passionate about doing something, and they're looking to folks like us to have these conversations and to really understand better about how to get into a proactive stance. And so I want to turn it over to you, Patrick, and hear more about what you're hearing from those healthcare clients. What are the challenges that they're facing? And what are they sharing with you as they're on the front lines of this industry?
Yep, great question. And thank you, Sean. Robin, it's great to be here with you today. The more that I talk to people in the healthcare space, the more alarming certain aspects of the healthcare space become to me. I've spent most of the last 35 years helping people use data to drive their organization, and they do a really good job of it, from e-health records, all the other stuff they've done over the last 2 decades. And you look at what they did through COVID, right? They were the warriors on the front line. And now when you look at certain aspects of the organization, they're looking to reduce costs. They're overwhelmed by the volume of people they're having to care for. They're under or short-staffed. Their turnover rate is higher than I think it's ever been. And they're investing money where they can, but you're starting to see things emerge that are themes or patterns which are disturbing. One of them that I see, my sister does a lot of recruiting for one of the largest healthcare systems in Philadelphia. And when I talk to her and different nurses, I'm starting to see something I haven't seen in 10 years. And that is this, we've come to the point where they accept that getting assaulted may be part of the job, which I think is completely unacceptable. These people, when they signed up to take that profession in college and become a nurse, become someone who's going to care for others, never did it say in that job description that you have to accept being assaulted at work or, not being protected or being able to work in a safe environment. So I think that's something that's coming out as an alarming trend. I think it's having an impact on scores, medical reimbursement, because patients are starting to feel that, right? Nurse turnover is high because nobody wants to work in an unsafe environment. So now you've got constant turnover, right? So that's one of the things that I look at this space that alarms me, that I don't think the administration is taking it seriously enough. And I don't think they're connecting the dots. They're not putting together the fact that this nurse's lack of safety is causing that turnover, which is leading to that patient's bad experience, which is causing a poor score, which is why you're having the issues of low revenue and cost cutting, right? And if you pull it back to something that's not normal that's happening, I think that's one of the trends or themes that's the most alarming.
Yeah. And turning to you, Robin, on a recent podcast, you did something that's pretty audacious. You talked about optimism in the space. So, countering what Patrick's hearing here, and it's an absolute real concern. We're hearing more about burnout. We're hearing more about shortages. In fact, the recent Mercer report pointed to a shortage of 100,000 healthcare workers by 2028. So, that's not the most promising trend, but what I love is the optimism that you bring to this conversation. And I think that optimism is rooted in some of the innovations, right, that Verizon is bringing to the market and some of the conversations we're having. So, tell me more about why you're optimistic.
Yeah, I mean, I think you have to be in healthcare, and but I'm not going to sugarcoat it. Patrick's right. I mean, this is we've never seen the kind of workplace violence, and that healthcare is not unique. We're seeing it, it on airplanes, across the board in really every industry. I think the pandemic changed a lot of kind of social dynamics that we haven't seen before. And Patrick's right. I mean, nurses they want to practice at the top of their license like our doctors. They got into this to help people. It wasn't in their job description to put up with this. And I don't think many people know how bad the shortage is, and it's daunting. I think until it becomes real for someone is when, their physician retires and they go try to find a primary care doc and realize that this is not easy, and we're not training enough doctors. We're not, creating enough nursing folks, and we are at a shortfall that is daunting. So how can we leverage technology to, not only keep them safe, but take, some of the automated work, some of the inputting of data away from them so they can truly be at the bedside is where they want to be. That's what they train for. But to Patrick's point, I'm optimistic because people are looking at ways out of necessity. I think the pandemic showed us that we can do a lot when we need to. Like older folks, go figure, they could actually use an iPad and have a telemedicine visit with their doc because they had to. We are not, I think we make assumptions that limit a lot of folks. And I think we can do more than, a lot of people think we can do, especially like our aging populations. They can do more than, I think we jump to conclusions that they can't do this, but in fact they can.
Right.
And I think to Patrick's other point about HCAHPS and star ratings and how that affects reimbursement, the patient experience and of equal importance is the clinical staff experience, because people, during the pandemic, visiting nurses, they were very expensive, and that's still a factor. And how do I keep the good nurses to want to work at my hospital? How do I keep them engaged? How do I give them technology? These are now digital first natives who are used to having, tablets, phones. This is part of their workflow. It has to be, intrinsic to what we're doing in hospitals. So I think, I agree with everything Patrick said, but I think we have to be optimistic because there's a lot of incredibly passionate people in this space that want to make a difference. So that having the opportunity to speak to them makes me optimistic for the future.
Yeah, I love that. And that's such a great transition into, talking with Patrick about building on that idea of connectivity, right? So what are we doing to, create that connected workspace? What are we doing to help address all of the factors down the line? I mean, we often talk about at Usto, how are we, where does it start? How do we even go into a patient or someone arrives at a parking lot of a hospital? And really kind of taking a holistic approach to what can be done, what's possible now, what's possible into the future.
Yep.
And how do we just start to think differently about it and bring to bear kind of that connectivity to make a difference. So I'll turn that over to you, Patrick, and, give you the floor to discuss that some more.
Yeah, I mean, just picking up on what Robin was talking about, we are absolutely excited, elated at some of these spaces that are starting to adopt technology. Right. So you think about the interconnected, you've got the old line technology that's now being replaced with artificial intelligence, not to replace a job, but to help the people that are doing the job do it better. So you think about the clinicians on the floor of an assisted living facility, not memory care, but just somebody that needs a little bit of help walking around, might be in their late 60s, early 70s, early 80s. The ability to keep an eye in case somebody falls, to get them care immediately, as opposed to you wait 2 or 3 hours until we make rounds and we can get to you. Technology can help people, and they're going to need that interconnection, right? They're going to need that dependable wireless. They're going to need 5G they can count on to go from building to building to deploy this kind of technology in their lifetime, one, not having to rip up the roads and everything else, two, and then that they can afford it. And I'm starting to see these people are coming forward saying, look, I've got the best clinicians money can buy. I need them to have the technology to take better care of these patients. So the systems and technology, once they get connected, especially with wireless and the 5G, the ability to do more without having to continue to add more staff might help. Now that we see the shortage that are out there, technology can help lessen that until we get more people into the profession.
Yeah, I think that's a great point, Patrick. And, some of the other things that we talk about is also kind of taking some of that mental load off, right?
Oh, yeah.
I mean, you talked earlier about, okay, that vision that a nurse or someone might have had when they came into the profession and what they're trained for. Now they're trained on security protocols, they're trained on protecting data, they're trained on HIPAA. And it can, not leave so much time to do the things like you said, to be bedside, to take care of a patient, to step aside and maybe spend a little more time with someone and really better understand what they're going through to really support them. So let's talk a little bit more about that, even about, around how can technology help to reduce some of that mental load that that contributes to things like burnout and, workforce attrition.
Yeah, I mean, there's a great quote. I think I've heard it from multiple people, but death by a thousand clicks. Doctors are now glorified data clerks in a lot of ways, as are nurses entering data into the records. So I think, to your point about how can we lessen those just repetitive tasks through ambient listening. You're hearing about a lot of AI, that will hear, and to make it. I love this analogy. Dr. Kazuki Nakagawa from UC Davis, amazing young doctor, who said, in the very near future, technology will be invisible. It'll just be running in the background. So nurses and doctors will, all of that, what we're used to, it's not me looking you in the eye, patient, doctor. It is screen, doctor, patient, right?
Right.
So I think that is shifting really quickly because the pajama hours that our docs are dealing with and our nurses, I think very quickly there's this realization, to Patrick's point about the staffing challenges, we have to innovate around that. And I think very quickly, and what I'd like to see in my lifetime is this technology that is always on in the background. And, from everything from security, using computer vision to see when someone's fallen, to understand, how efficient we're doing our workflows. And to earlier point, how do we put that technology that's not, a burden on staff, but really just enabling them to do what they are passionate about doing, delivering care better. We don't want to introduce things that are another piece of technology they have to get into their workflow that's taking time out. How do we make it? How do we make their jobs easier? That's at the bottom of the bottom line. How do we make it easier for them and not just putting another impediment on them?
And I love that, going back to even just, your introduction and talking about the impact that your experience had, right? As a patient on the receiving end. Yeah. We all know when we're being rushed. We all know when that attention is really not on us, and when it should be. And I think about, we don't want to just think about patient scores and burnout, but it just creates this much better experience all the way around for everyone. So one of the things we talk about, Patrick, too, a lot is kind of that idea of, when you see something, say something. Yep. And I know we're focusing a lot on, clinicians, nursing staff, physicians, but, some of the other staff within hospitals are being asked to do near impossible tasks, right?
Yep.
I think about our security staff and some of the things that we're asking them to do that just aren't even humanly possible.
Yeah.
At the same time, they recognize the importance of their roles. They are doing their absolute best. But a lot more is happening now, as you mentioned, since COVID. There's a lot more going on. So, what is USO doing, and how that connectivity, what types of capabilities does it enable to support that area of a hospital system?
Mm-hmm. Great question. And I'll go back to what I said earlier. The nurse signed up to take care of patients, just like the doctors and the clinicians signed up to take care of and treat and help cure patients. They didn't sign up to be an EHR 60% of their time entering records. They signed up to see patients, not to enter notes about the time they saw patients, which is, it's kind of inverted and, might be slightly dysfunctional. So I love the idea, Robin, of bringing technology in the background to help kind of take more of that load off, because that's going to allow more of the patient clinician interaction, which is going to lead to better outcomes. It's going to lead to happier, more satisfied clinicians, which will stay in the profession and may smile at their neighbor, who their neighbor's kid then goes into school and says, I don't mind being a doc. He comes home smiling all the time. But for the nurses specifically, one of the big things that we see is you mentioned COVID earlier, Robin, how it has us being a little bit out of sorts and not really quite ourselves. When you see this coworker on coworker, because the anxiety is so high, the stress levels are so high, right? They're doing 10 jobs, right? They have to care for patients. They have to keep an eye on patients they're not with right this second to make sure they don't get out of a ward or somebody doesn't come in and take a baby. All these things that they're responsible for that they really have not much control over, because unlike our mothers, they don't have eyes in the back of their heads at the jobs right all the time. Right. So they're tasked with doing all this stuff, which adds to their stress, which adds to the burnout, which adds to, they get a little intolerant with each other. Right. And then you end up with issues in the workplace, and it all just compounds. What we've released in the last year is a set of algorithms that we've made available on the edge, which is amazing to see, put it on Verizon's technology and let's see if we can help people.
Yeah.
But the ability to take these algorithms and put them into a clinical setting where they're helping with things like someone that fell. Someone is sitting at a terminal who's not the HIPAA certified person that should be sitting at the EHR spot, right? So you have all of these threats that are coming at an organization. I get calls from hospitals after a child has been taken from the maternity ward. It can't happen, right? We have systems for that. We have bracelets for that. We have lockdown for that. We have protocols for that. And yet it happened, right? Because someone was not at a desk doing the one thing that when it breaks, the protocol breaks down and a child is now missing, right? These are the kinds of things that technology can provide, that second level of authentication for people. We can give algorithms that give you data So the clinicians can make decisions on, is that person's walk the same as it was yesterday? You know, is that person becoming a little bit more wobbly this week? Are they not making the same rounds that they normally make? Is it diet? Is it occupational therapy, physical therapy, some help that they need? Or do we need to run labs to see if the blood works right? So giving them that proactive ability to care for patients, right? That's something that these algorithms can do. We talk a little about keeping people safe. Our mission is simple: protect people. And using these algorithms to do that is what we do. We talk to security people about pushing the envelope further out from the hospital to protect their workers. We see a lot of people going at pharmacies. We see a lot of threats of, the worst thing I hear in the news is known to law enforcement. Well, if they were known to law enforcement, why is it that the hospital is now dealing with 3 people stabbed by someone who you're calling a serial killer, who was known to law enforcement, arrested 3 times, and had a warrant, felony warrant for fleeing the state of New Jersey, right? And now they're at the hospital and they're looking to do harm to your workers. So I think we need to do a better job using these technologies. They're out there. They can help. And specifically, our algorithms are something that are helping people today.
That's amazing. Yeah, it's too bad that it's not only healthcare. I mean, I read an article recently about librarians and similar. These public places that are accessible. Libraries, traditionally very safe space. Hospitals, safe space. Nurses, the most trusted profession by a long shot of any profession in the world. Nurses have that most trusted, status. And bad things are happening. So we have to move faster to protect, these essential workers that are, their front line. I think there needs to be some government intervention to provide funding to, as Patrick was saying, to put this technology into place. I mean, like I was saying earlier, we're at a crisis moment where if these kind of, workplace incidents continue to accelerate, we're risking our critical infrastructure, which is our docs and nurses, and we can't let that happen because healthcare is hard to begin with. You can't have this as another component of it, and I think even in normal times, it's challenging, and you can get burnt out because these people care incredibly. It is impressive, and I'm always in awe of our nurses and docs because they are on that front line trying to make us better. So this can't be we have to make this stop through technology. So.
Yeah, absolutely. We were talking earlier and I mentioned something. You said that was the first time you'd ever heard that, but we compared, and we do this often, right, Patrick, where we talk about the parallels in different industries we serve. And, many people would not think that a hospital and a casino have a lot in common, but they do. They're open all the time. Yeah. You've got people, flooding in. You've got people in various states of excitement, distress, some on their best day, some on their worst day. They just lost everything. Yeah. You've got, people who are banned. There's a lot in common there. And, when we can bring innovation to bear that's working in other industries. I love the idea of cross-pollinating, right? And saying,
what's working in other industries?
From that?
Yeah. I mean, I think other industries, hey, listen, healthcare, and they will admit they've got a lot of incredible innovation in the OR and in that what they have to deliver, which their priorities delivering care. But the rest of the infrastructure has fallen behind: finance, retail, where their mandate is to deliver care to whoever comes into my doors, whereas other industries have the priority, different priorities. So technology, security, all those things, I think, have taken a backseat, unfortunately. And then now, to my earlier quote, they're moving quickly to level up, and they're looking to other industries. We do a lot of work with the NFL, experiential places where the fan experience is critical. I mean, they are kind of the peak of experience. You go to SoFi Stadium in LA, that's the most wired stadium in the world. I mean, we have the ability to have 7 views from 7 different cameras on every play. I mean, it is ridiculous. Right. And, we're using facial recognition to get a frictionless fan experience of walking in, and that's growing and growing and growing. And so looking at that, how do we leverage that in healthcare where, to your early point, we were talking earlier, and, I'm a doc, I'm scrubbed up, I've taken, I've been meticulous scrubbing up, and now I need to get in that door. I got to find my badge. That's not great. It's just facial recognition that will recognize me, even if I'm wearing a mask. Those kind of things are doable now. We got to move forward and look to other industries as reference points.
Yeah, I love that.
Well, Robin, you made a perfect point, right? So what I think the administration in the hospital hasn't realized just yet is what all of the others have, is that customer experience is interconnected with their bottom line and with all the other things that drive their business, right? It's not separate from safety, especially when you're dealing with places that are open almost 24 hours, right? And they're open to the public, right? So they have a whole unique set of issues that they have to deal with. SoFi Stadium, all of these places, they have the public coming at them. So safety is a concern. It's no different than a hospital. You brought up the librarian, so I'm going there, right? The librarians have the same exact issue. In Florida, there's a large county that classifies predators as a unique status. They let them back out on the street, and they tell them that you are not allowed within X feet of children who would be at the library. So now the librarians have to keep an eye on predators that would be going into the library to prey on kids. Again, you're putting a job on them they didn't sign up for, nor are they equipped for, right? That data, using a wireless edge capability, can detect that person coming towards that building and give information to local police or authorities or, people in charge to say, hey, here's something that you might want to take a look at, right? See something, say something. You tell us to do it. Why aren't we using the technology to do that? It'll do it a heck of a lot better. It'll make far fewer mistakes, and you'll still protect people's dignity, privacy, and everything else. They're interconnected. Once people realize that this is about customer experience and not making other people do everything, and they start using technology intelligently, I think it'll start to lessen some of these issues.
Yeah, that's the hope.
Yeah, I think that's a great way to kind of wrap things up. And, what I'm hearing is, in addition to an expectation of care, there's an expectation of protection. We talk about, that's what we talk about every single day. And the impact of protection on the bottom line, the impact of protection on the shortages, the impact of protection on your care. And you're right, when we get to that kind of magical place where it's just there, right? And you can kind of relax and say, I'm good. I feel safe. I know my baby is safe that I just had. My loved one is safe. I think really amazing things will happen.
Yeah.
So I want to end on that kind of optimism and, talk about what you think healthcare organizations should have on their to-do list going into 2025 when it comes to, innovation.
Yeah. I think and Patrick, you nailed a couple of the big things. I think it only takes one really bad incident to ruin reputation and to really impact your bottom line. And in healthcare, that's life and death. Not only does if your network goes down, your critical systems go down, and you have to go back to paper. You're not able to let the ambulances come in. You have to triage to other, and it is. It is critical infrastructure that is real,
Mm-hmm.
and they're easy. They have been traditionally soft targets, and I think we're hardening those targets now. The realization of we have to make these secure environments, not only from the technology and the data perspective, but of our staff, and we can use technology for all of that. And I think the realization of it only takes one baby to disappear to change the whole dynamics of your bottom line, and you have to invest early and it'll bear fruit. And that speaks to the nurses feeling better about security, the patients knowing this is a trusted, safe environment. I think that investment has to be made. Another thing I'm really excited about is, in traditional environments, the hospital environments, I spend a lot of time there, but I think there's a lot of focus on connecting the care ecosystem into the home. Yeah. And really, when you're in a medical clinic or hospital, that's a snapshot of time, and Sean, in that snapshot of time in your life. But the 99.9% of time where we're living our lives in our homes, in our car, on the go, I think there's really starting to be, a lot of connecting that ecosystem through wearables, through AI, through all kinds of sensors in the home for how do we age in place better? There's not the critical infrastructure for in assisted living. There's not enough of those facilities.
Yeah.
How do we let people be in their home more? How do we triage care into the home? So I think I'm passionate about really addressing that with key partners to try to make that a reality so that the care teams in the hospital will have better views of their patients in the home. So at the end, and what does that mean? It means we can intersect earlier with people who have, bad conditions. So they don't show up really ill at the hospital and then, nurses and docs have to deal with really sick people. How do we move to a more value-based care, continuum of, seeing the data points earlier so we can intersect earlier so people can live a better quality of life. So that's what makes me excited, and I'm going to try to stay optimistic about it.
That's really good stuff. Patrick, do you have anything to add?
Yep. I share the excitement. When you look at all the interconnection and you look at all the IoT devices, if you go back 10 years, I did some stuff with Cigna and others with watches and stress levels of people in call centers. And it's fascinating to see where IoT is going to give people data to take better care of people, whether they're your employees in a call center in a high stress environment, or it's somebody being released a day early after surgery that has data that the doctor can now keep better care and not just wait for them to call when they have sepsis, right? And then you mentioned assisted living, in all stages, 60s, 70s, 80s, when you go from I'm still playing golf and bowling to now I'm just in the pool to now I don't want to be locked in a room. I'm not here to die. I want to get out I want to smell the roses, right? Let me walk about the grounds. Can you use this edge technology to keep me safe? I don't want my mother, father falling into a pond. Can you keep them from eloping? It's thousands of people pass away each year, and we can almost bring it to zero by taking this type of technology and putting it into that industry. So I am really excited about those few. They're going to be a few lighthouses, and you're going to watch them. They're going to light up, and they're going to do a phenomenal job with your technology in mind. And they're going to beacon out to the rest of the world and say, it's time to use this technology to provide better outcomes for these patients, better for the brand, right? I want to put my loved one in a facility that's going to adopt that, right? Yes, make a small investment, but look what it's going to get you as far as your business and the patient outcome, right? So I'm real excited about what some of these early adopters are going to do over the next, quarters, not years, quarters.
Mm-hmm. Thank you, Patrick. And thank you, Robin. This has been a great conversation, and we welcome continuing the discussion with you. And yeah, we are absolutely optimistic and, ready to be a part of the change and the solution.
Thanks, Sean. Thank you, Patrick. Great to be here.
Pleasure, Robin. I'll meet you at the hospital. We'll do good things.
Yes, sir.